Welcome to Talk Law Radio with attorney Todd Marquardt of the Marquardt Law Firm at marquardtlawfirm.com.
Welcome back to Talk Law Radio. I'm Todd Marquardt. You may have noticed if you're watching on Facebook Live or if you're watching on YouTube later that I'm sporting the mustache today. And I'm not going to shave until I look normal again with my goatee. So my mustache is getting pretty long, and I might be able to shape it like a real Texas Yosemite Sam one time soon.
Nice.
So we've been talking about home care with Larry Cruz and Angela Barker. And before we get back into that, I wanted to ask you guys about the time change, which is going to happen 2 a.m. Eastern Time this Sunday. We're going to fall back. How does that make you feel, Larry?
To me, I don't like it. You know, I don't like the fact of waking up and going to work when it's dark and then arriving home when it's dark as well.
Right.
You know, it just, you know, with me mentally, it kind of messes with that state there. And I'm just, I don't like it. Not a fan. I love the sunlight.
It does certainly change things. And there's been some studies done on the chronobiological effect of the time change. Mm-hmm. And those scientists are way smarter than me, so I won't try and quote their report. Just know that there's studies out there. Angela, how does it make you feel?
So I'm not a fan either because it takes me at least a week just to adjust to it. And a lot of times I'll have to take Benadryl so I can fall asleep.
Go to sleep earlier.
Yep, just to get me, try to get me back in the rhythm. So it definitely throws me off.
Mm-hmm. Well, I have a friend that does the essential oils. Mm-hmm. She says lavender is good to help you fall asleep. It's a calming. Okay, so let's move on from daylight savings and go back to home care. Part of what you do is private duty nursing.
Correct.
What exactly does that mean?
Sure. So private duty nursing is essentially long-term skilled hourly care in the home. So essentially that's an LVN and RN needed to care for a patient who is generally G-tube, trach, vent dependent. So to care for those three items, you know, that's a skilled need. So a home health aide or a CNA who doesn't have that training, doesn't have that license, can't perform that care.
Angela, so you're a nurse.
Yes.
You kind of know what that training is and what those skills are. Can you tell us more?
Yes, and there's also at times where patients have urinary catheterization, so could be every 3 hours. So there's other skills as well, just included in to where it's counted as skilled, but definitely they do have to have some skilled need. What Medicaid or different insurances look at is, what is a nurse doing while they're there? Why am I paying the nurse to be there?
Right.
And so so we have to show that the skill is requiring a nurse to perform that. So for the feedings, they have to have at least 3 feedings, I believe was the guideline before in case during the shift.
For a feeding tube?
Yeah, via the feeding tube, yes.
Okay.
During the shift of the nurse, there's certain requirements that the insurance, it just depends on the insurance provider. Sometimes those requirements change. But yeah, they look at what is a nurse doing while they're there, like suctioning. So if they're dealing with a trach patient, how many times is a nurse suctioning the patient? During the day, are they documenting the trach care, the G-tube care, things of that nature? So it all comes down also to the nurse's documentation. So are they documenting the care that they're providing? Because the insurance company will look at that.
And you're good at that. And in your new role as legal nurse consultant, that's what you're mainly looking at.
Yes, exactly. So nurses out there, make sure you document.
Okay, you mentioned skilled. What are some unskilled services that Maxim provides?
Sure. So some unskilled services we provide are companion care, personal care attendant services, and essentially they are doing what is called assisted daily living activities. So these are patients who aren't able to maybe bathe themselves or need assistance bathing, dressing, transferring, light meal preparation, and some housekeeping. So those are generally the things that we do when it comes to unskilled. We've done it for active duty service members who are injured. They might need some supervision, or they may need some assistance with those things that I had said, or we've done it for really any adult, really up to seniors who just need that extra support in the home. Generally, there's a spouse, a son or daughter who wants to make sure that their loved one is taken care of. So they reach out to us to be that extra support, and sometimes they can be a minimum of 4 hours a day all the way up to 24/7 care.
Angela, what was your experience working at Maxim when it comes to the holidays in home care?
So with the holidays, it was definitely a little bit more chill. So a lot of families, some families want to go take some time off and spend time with their families, maybe out of state or out of the city. And also, or sometimes they will need that extra assistance, and they have a caregiver or nurse that's been with them for a long time. So they're kind of like family. So it helps them to be able to focus on the holidays and be able to celebrate the holidays because they have that assistance with the care of their loved one during that time.
Yeah, it's a weird thing for sure, because you can have that calmness, in the office where it's not too crazy, and then the at least maybe that week of, because everything's been settled, the people already know the schedules. If there are going to be open shifts, the families are already aware of it because the nurse, a week or 2 weeks before said, hey, I can't work, because not only the families have their own things, but the nursing staff have their own, and they're human beings, right? So they have their own families that they may not want to work. So it can be stressful whenever there's a call out for shifts that need to be provided, because the family does need that care, but yet, now you're trying to get nurses to work on Christmas Eve or on Christmas Day. And then that adds an extra stress to the recruiters who, don't wear many hats. They don't just recruit, they also manage the scheduling. So they're trying to make those phone calls and make sure that family gets coverage.
Are you looking for nurses that might be interested to be considered for those times?
For sure, yeah. I mean,
the holidays are coming up.
We always need PRN nurses, for sure, to be backup. Even strictly PRN nurses. So, maybe they don't get a permanent position, but they give us availability, weekly, monthly. We can make sure we can put them in, because there's always open shifts.
So PRN means as needed.
Exactly, yeah, as needed.
Yes.
And that's a very important pool for us, because there's call-outs all the time.
So what's your number?
210-341-3800. That's the office number.
Okay. If you're looking for a PRN position and you're a nurse or an LVN or a CNA, they can call. And if you're interested in working the holidays for certain, because those emergencies could come up, like if somebody's being discharged from the hospital on a holiday, they need somewhere to go.
Yes.
Yeah, that's true. They definitely do need somewhere to go, and usually we get, there's a lead time for us to be able to get them, because it is, when it's complex services like that, it doesn't happen overnight. So it does take a bit for us to get the authorization, check the benefits and eligibility for the patient, get the authorization, the doctor orders needed to be able to provide services in the home, submitting for those authorizations. And then once we get it, then, we do all that prior to discharge to make sure when discharge happens, we have staff and nursing able to start that day or the day after.
That makes me think about, besides having the nursing degree and the certification, what other things do you do to ensure that these are good quality healthcare workers?
Background checks. I mean, that's definitely important for sure. So our recruiters, get their demographics, kind of get what they're looking for, what they want to do. We do behavioral interviews. So, if they think that they're, they have the skill set, and the recruiters can get a general idea of if they have the skill sets. It's usually up to the clinical interview portion where they qualify them as far as like having the necessary skills to care for our patients initially. But background checks against their licensures. We do state and local background checks as well. And then once they go through our hiring process, they go through what Angela had kind of alluded to before, was the skilled competency. And that's where they return demonstration and go through a series of revalidate their skills, essentially, in our office.
And
or do more training.
Yeah, and then they also do an in-home orientation. So it gives the client and the family the opportunity to meet the nurse, and then the nurse kind of gets to see a preview of the care. And so then they can see, okay, is this going to be a good fit? Because they may have all the skill set, and we may have thought they were the perfect fit, but then personality-wise, they weren't a match. Or maybe they just think that it might be too much care, like it might be too overwhelming for them. Maybe they need, like you were saying, more training. So we need to, at that point, we can catch that before they actually, fill a shift.
Right. Reminds me of The Sopranos.
Huh.
You remember when Tony's mom threw the caregiver out?
Yeah, that happens for sure sometimes.
Yes.
Well, we got to take a break. When we come back, we'll be talking about how to pay for home care, and we'll talk about our favorite segment, the legacy segment, and talk about some Thanksgiving tradition. So stay tuned.
This has been Talk Law Radio with attorney Todd Marquardt, brought to you by the Marquardt Law Firm. You can learn more at marquardtlawfirm.com. And be sure to listen to the full Talk Law Radio show Saturday mornings at 11 on 9:30 a.m. The Answer.
Attorney Todd Marquardt talks about the law. His mission with the Talk Law Radio show and podcast is to help you discover your legal issue blind spots. In the beginning, God had one law. Don't eat from the fruit of that tree. Then came the 10 Commandments. Now we have federal, state, and municipal lawmakers that won't stop creating new laws. Laws that might impact you without you knowing it. Listen to the show and drop a line on Facebook or email host@talklawradio.com and let the host know what you think of the show, the topics you want to hear, and whether you want to be a guest.